America's healthcare system is the greatest in the world, is what people say. But I'm here to argue that Korea's healthcare system is much, much better. It's time for a reality check. America is the only industrialized nation in the world without a universal healthcare system. Let me repeat that. The wealthiest nation in the world, in the history of the world, cannot provide basic healthcare to all of its citizens. One of the main reasons for that is that Americans value choice, while here in Korea, I'm enjoying the benefits of living under the Korean system of forced health insurance under a public plan. And it's working out very well. I am no health expert, but I've lived in Korea for over 10 years and in the United States for around 20 years of my life, so I kind of know a little bit about how the healthcare system works. So let's talk about why I think the Korean system is actually better than the American system. First off, it's much cheaper. I mean, much, much cheaper to be in Korea than in America when it comes to healthcare. From the moment you step foot into a Korean hospital until the moment you buy medicine at a pharmacy, it's all cheaper than America. Like, all of it. Part of the reason is because health insurance is mandatory here, and it covers a lot, from general health checkups, to the medicine you buy, to surgeries, to tests and diagnoses, like all of those things. Diagnoses? Sometimes it's hard to visualize it, so let's just look at the numbers to see why Korea's system is much cheaper than the US system, starting with the insurance and what it covers. Inpatient hospital care is going to cost you 20% of the actual price that the hospitals charge. If it's 100,000 won or $100 procedure, it's going to cost you 20,000 won or $20 US. Outpatient care is going to cost you 30 to 50% of the price the hospital charges. And if you're talking about the pharmacy, you're paying 35 to 40% of the actual cost of the medicine, which, by the way, is already way cheaper than the prices in the United States. So in Korea, when I go to the doctor's office, I pay $20 for an appointment and get $6 worth of medication from the pharmacy, leaving the total to be around 26 US dollars. I mean, that's kind of amazing, isn't it? But let's look at some bigger numbers. If you have open heart surgery and you need a valve replacement, that's gonna cost you around 50,000 US dollars. And after insurance, that'll be 10,000 US dollars. Whereas in the United States, according to debt.org, the overall price is 170,000 US dollars. And with insurance, it's gonna be less, but probably still more than the payment that you would have in Korea for that same surgery. Another cool part of the system is that if you want more, you can get more. In the United States, one of the main arguments for keeping the private insurance system is that I want to have choices in how much I pay and what kind of plan I have. Well, that's fine, you can, and so can Koreans. The Korean insurance plan goes like this. There is the government insurance system that everyone is covered under, and if you want additional insurance, you can buy additional insurance. That additional insurance can reduce the costs at a hospital or give you travel insurance or maybe protect you from those unseen costs such as potentially expensive cancer procedures. Anyway, in South Korea, you still get choice when it comes to how much insurance you want. It's just that everyone gets the basic health insurance. Next up, Korean doctors are good. They're very good. This isn't exactly an argument for why Korean doctors are better than American doctors. I just want to dispel the myth that America's doctors are the only good doctors in the world, because for some reason, a lot of Americans think that. Yes, it's true, America has some of the best universities in the world for medicine, and they also have some of the best facilities, like the Cleveland Clinic in my home state of Ohio. But that doesn't mean there aren't smart Korean doctors out there as well. It's weird because in America, we have these stereotypes. Asians are good at math and science. And yet, when it comes to doctors, we're like, we need American doctors. Again, not to knock American doctors, they're some of the smartest people in the world. I'm just saying this dispels the argument that American doctors are necessarily better than Korean doctors. Next up, another reason why it's such a great system is you are forced into the system. And while we as Americans don't like to be forced into anything, when it comes to healthcare, it's a good thing. There are a couple of reasons for this. One is that if you are forced into a system and then need surgery or something very expensive, it's good because you now have the insurance required to keep costs down. Even foreigners have to do it. As of July of 2019, we all have to enter this system and pay for health insurance. This is a great thing because it spreads out the costs. When you have more people under an insurance plan, it means that we shoulder the risk of everyone better. More people carrying up the system. On top of that, it's good news for hospitals as well, because in America we have a system where anyone can get treated regardless of whether or not they have insurance and whether or not they can pay, as long as they go to the ER. And guess who shoulders that burden when it comes to patients who can't afford to pay for their treatment? Hospitals. But you know who really shoulders it? Government. The US government, which means us, because we're the taxpayers that give money to the US government, because the US government gives tax breaks and even subsidies to hospitals that do take these patients. Another reason this is good is because as a whole, it means more people will get regular checkups, which will be better in preventative medicine, in that you can catch some diseases early so it doesn't burden the healthcare system later. Getting checked out early is a good thing, and if you have insurance, you're more likely to get checked out early. Another reason the system is better in Korea is that payments into the system are tiered. That means that you are paying just a little bit more the more money you make. When I was a grad student, I made $0, and I was paying $15 for my health insurance every month. That's awesome. Granted, those minimum numbers have gone up since then, but they're still pretty cheap. And as you make more money or you have more assets, you will be paying more into the system, which makes it more fair. In general, if you make more money, you should pay more into the system. At least that's my belief. Whereas in America, yes, the poorest people can get Medicaid to help cover their expenses. However, there is a cutoff, and if you are above that cutoff, you pay the same amount as every other American for health insurance. At least the plans offered to you are the same. The final reason the Korean system is better is that there is no such thing as an out-of-network doctor, at least not the way we see it in the States. This is going to confuse a lot of people outside of the United States because this concept is stupid. Basically, under certain insurance plans, there are some doctors that are not covered under that plan. They are out of the insurance plan's network, which means if you go to that doctor and you get treatment, your insurance may not cover that treatment. If you don't know your system well, you may go to the wrong doctor. Or in an emergency, you might have to go to the wrong doctor and get stuck with a pretty big bill that your insurance won't cover. This is a completely archaic and stupid system. No, it's not even archaic. Even cavemen wouldn't be that dumb to have this system. It's just a dumb system. We don't have it in Korea. You have it in the United States. So those are some of the reasons why I think it's so much better to be in Korea than the United States when it comes to healthcare. Now, there are some caveats. For example, there was a survey by InterMD, which is an online website, that found that 72.9% of Korean doctors had at least once thought about working in a different country. 66.8% of doctors preferred working in the US, and the reason for that is that they wanted a better hospital environment. And that says a lot about the American healthcare system and its reputation. Doctors want to work there. And I will say this, if you are a doctor or you have a lot of money, perhaps then the American healthcare system is the best system in the world. However, this was a survey done in 2019, well before the COVID-19 crisis happened. And now that the American system is in a shortage of masks and ventilators and overall protective gear, I wonder if those same Korean doctors would change their mind now. Another thing I wanted to point out, the whole waiting for doctors thing, if there's a national health insurance, that a lot of Americans point to as a reason why you don't want to get nationalized insurance, is bogus, because I've literally never waited for anything in my life in Korea when it comes to the healthcare system. So that's it. What do you think about that? Do you think the Korean system is better than the US system? Agree or disagree? Be respectful in the comment section. I would love to hear about your experiences in America, in Korea, or in whichever country you are from. We all have a lot to learn. And as a final message to my friends and family in the United States, please stay safe. Please practice social distancing. Please wear a mask. It's not weird. I want everyone over there to be healthy and to get through this. And not just to Americans, to everyone out there watching. I hope you all stay safe. Take care of yourselves, and I will see you next time. Goodbye. Haseyo.